Hey everybody, if you're suffering from painful plantar warts that aren't going away no matter what you're doing, well, I'm going to share with you what works and what doesn't work in order to give you some pain relief. So stick with me and we'll get into the episode. And hey everybody, I'm Dr. Gaffney from Dr. Gaffney Best Foot, and I've been sharing free tips and tricks, what has helped my patients over the years in order to save you time and money. And we're going to be talking about warts. We're going to first talk about what is a wart, why it's so hard to get rid of a wart, how to tell if it's really a wart and not a callus, the risk factors of getting a wart, and also treatments that work and treatments that don't work, and new treatments that are coming up. So I'm going to share what's worked the best over the years. There's so many products out there, but I'm going to show you what really has helped my patients. So what is a wart? It's a small area of skin that's infected by a virus, and the virus is called the human papilloma virus, and it lives between the epidermis and the dermis and the bottom layer there, the basement membrane. So it sets up shop there as a virus. And on the bottom of the foot, there's a thicker dead skin layer called the stratum corneum. And so the overall skin is thicker, and that's why it's hard to get rid of the wart down there at the bottom of the skin, because the skin is thicker. So that adds to the challenge of treating it and why it's so hard to get rid of it. So, and there's layers of dead skin over the top, and sometimes it's hard to tell if it's a callus or a wart. I have a lot of primary care physicians referring patients to the office saying it's a wart when it's really callus, and vice versa. So even doctors a lot of times can't tell the difference. The only way to know for sure is taking off that callus off the top and seeing what's underneath. But overall, we're going to be focused on today the warts on the bottom of the foot. They can really occur anywhere. There's skin on the top of the foot, any place on your body where there's skin. All right, so how do you determine if it's a wart or not? Warts are very circumscribed and defined. There's a distinct difference between healthy skin and the wart skin. Usually the skin lines are interrupted. So that's one key way to determine if it's a wart. The skin lines are interrupted. They don't go through the wart. Also, the top of the wart looks lumpy and looks like cauliflower. And there's normally a lot of callus on the surface. And usually your doctor will shave off all that callus, which doesn't hurt because there's no nerve endings in it. And underneath there's little tiny stipples of pinpoint areas of dry blood, and that's just the blood vessels growing up into the wart. So your podiatrist will shave that off to see if there's pinpoint bleeding to determine if it's a wart, and that's usually how we can tell if it's a wart. Those are telltale signs: the skin lines being interrupted, the stippling, the cauliflower surface. But if you end up having surgery, they'll most likely biopsy it to determine if it's a wart. So, and the risk factors that are involved, for one, on the bottom of the foot, you have a higher probability to getting a wart because of the shear forces and all the pressure that you get there. So, and also the bottom of the foot is more susceptible to skin punctures or trauma that can introduce the wart up in there. And the foot is in a moist environment with shoes and socks all the time. And with feet that sweat a lot, it can carry that wart virus to other places on the foot and set up shop there. Times when the wart modifies or multiplies, it can turn into like a mosaic wart, and that's when it's really difficult to get rid of. Other risk factors include younger age. So when you're a child, you haven't been exposed to the wart virus, so your body hasn't mounted an immune response to it, so you're more likely to get it as a child. And also warts are highly contagious, so if you go to the pool or you're sharing a shower with someone that has a wart, you can get it that way as well. And that's why if you're in a family and there's one child that has a wart, I always tell the parents to either spray Lysol in the tub or have the other children use a different tub. And there's many treatments online. I'm going to show you what has worked. Number one is just tincture of thyme. Warts spontaneously resolve in 2/3 of children within 2 years, and it is slower in adults and can take several years to resolve, according to the British Association of Dermatologists guidelines for management of cutaneous warts, and I'll list the study there in the description. So tincture of thyme. So you can wait. In kids, they'll spontaneously resolve, but in adults, they're not likely to do so. And also it does take time for these treatments, so you gotta be persistent. So the number one, well, other than waiting, in observing. Number one is keratolytics. So keratolytics are just a medication that's topical, and it's just a term that describes removing callus off the surface of the wart. And the callus kind of protects the wart, and the wart stimulates the keratinocytes, and those are little cells in the skin that make callus in dead skin. And the keratinocytes become more active because of the wart. And just a word of caution about keratolytics, there's all kinds of different types, but they kind of lift up the top layer skin. And if it's over aggressive, it can cause a wound. And because of that, I usually tell my diabetic patients or patients with poor circulation or people with numb feet not to use this, because you could get a wound and an infection if it's over aggressive. Salicylic acid is the most common keratolytic used for wart treatment. Most over-the-counter products have only 17% salicylic acid, which in my opinion is not strong enough to resolve the wart on the bottom of the foot because the skin is so thick there. So a lot of times that doesn't work over the counter. And when my patients come in, I usually have them use 40% salicylic acid paste. And there's one on Amazon now. It's Mediplast, and it's 40%, and it's like a little adhesive pad. You can cut it to fit, which is good, because if you put it on just like a Band-Aid and it covers the healthy skin, then it'll get, the healthy skin will get irritated, and we don't want that to happen. So you want to contain the salicylic acid pad right on that wart. So you leave it on, I'd say about 2 days. You can cover it up with tape or Coban, just so it stays put, because on the bottom of the foot it's me rubbing and everything. So leave it on for 2 days. I usually tell my patients, and then give your skin a break for a day afterwards. And the next thing you need to do is I'll have my patients occlude it, either with that tape or the Coban. And also the wart needs to be debrided on a regular basis. So I have my patients come in and I just use like a little scalpel and shave off that dead skin layer off the top. So debridement of the wart on a regular basis is important because all that dead skin layer over the top. So we have the patients come in, I shave off all the dead skin layer, and then I'll put a chemical treatment on there. Back before the high deductible plans, I would have patients come in every week, and I'd put a strong acid on the wart, cover it up, and have them leave it on till the next week and then debride it again. But now with insurance plans and co-pays and whatnot being so expensive, we can't do that anymore. It was really effective treating warts that way, but now we can't do it. We have to have patients doing treatments at home. Common questions I get asked is, why can't you just numb it up and remove it? So when you numb it up and remove it, because the wart's down there at the basement membrane, that right at that mark there, if you go past that mark, you can create a scar, and the scar, and there's always the microscopic wart viruses around. So you excise out the wart. If the little microscopic wart virus is around, it can get in that scar, and then you can get a warty scar, which is the absolute worst thing and so difficult to get rid of. So when you excise it, I usually have the patient use a medication to kind of resolve the wart virus around the area, and have them stay non-weight bearing to prevent a scar, because when you walk on a wound on the bottom of your foot, you can get a scar, especially when you have any excision that goes past that basement membrane. You can get a bad scar. So that's why, because most people don't want to be non-weight bearing for 2 to 3 weeks after an excision. So the next treatment is immunotherapy. So that is the process of activating one's immune system to eradicate skin tumors or cancer, and you can use it with wart treatment. So there are some over-the-counter topical medicines that work in this regard, and the one I like the best is called Vircin. This works really well. It contains an immune modulator and an antiviral component, as well as salicylic acid. So there's 3 different ways that it acts on the wart, and that's why I like it so much. You really have to hit warts hard to get rid of them. It's effective in resolving warts over time. You use it once a day up to 12 weeks. Let the product dry before applying the sock. not designed to require dressing, but I always have a patient use an occlusive dressing over top. The occlusive dressing kind of lets the wart or the skin have moisture, and that's also very good at letting that top layer of skin come off. It's almost like a natural keratolytic when you occlude skin. So with the Vircin, success rate has been claimed up to 88%, and in my practice I've seen this. It works wonderfully, and it's over the counter, and patient can put it on at home. And I like this product as much as I like another product I'll be talking about, Aldera. And I found it to be very successful in treating multiple warts, especially in children. And I'll have a link in the description where to purchase that online. So next is prescription topical treatments. Epudex cream is one of the prescription topical treatments that I'll use. I'll use that in conjunction with the salicylic acid. And the Epudex is a cream that interferes with DNA formation and stops the growth of warts. It's also used to treat skin cancers. So Epudex can be used twice a day. You apply a Q-tip to the wart under occlusive dressing. And this needs to be used for approximately 8 to 12 weeks. Same thing with the Vircin. It's around that length of time. And with both those treatments, actually with all the treatments, you got to debride it. It should be debrided about once a month. So I'll have the patient come in once a month, and I'll sharply debride it at that time. The Epudex cream costs around $35. The cost of the Vircin was $45, so it's not too bad. The next one is one of my favorites, the Aldera ointment. This activates immune cells and an inflammatory process to attack the wart. It directly kills the wart virus. It was developed first for genital warts, but it's more commonly used for plantar warts in the podiatry world. It comes in packets, and it's applied to the wart 5 days of the week. So we have patients apply it every other day under an occlusive dressing. And I usually have my patients use salicylic acid on the days they're not applying the Aldera. And then again, I have them come in once a month for a sharp debridement. Cost of Aldera is about $56 to $64 for a pack of 30 cream packets. They're small packets, but you might be able to use one packet to treat like 2 to 3 times. I have found much more favorable results with Aldera versus Epudex. And with all these treatments, the key is consistent, faithful treatments, consistent with the occlusion for at least 2 to 3 months to see results. So you got to be patient. And once they start to get treated, especially with the keratolytic, it gets softer, and that way it doesn't feel so much like a rock in your shoes. So that part's important. All right, so now the new treatments that are out there, and it's the Swift microwave treatment. It's a new treatment using low microwave energy to trigger the immune system to eradicate the warts. It takes a few minutes in the doctor's office. Multiple treatments are needed. It is recommended that treatment is done monthly, up to 3 treatments. After this, the claims are that the wart gradually shrinks over a period of 6 weeks to 9 months. It proves to be a promising treatment with up to 83% success rate. I've never used this device. It's extremely expensive for a doctor to purchase, and the cost for a doctor to purchase it is around $28,000. Also, at this point in time, health insurance does not cover it. Therefore, these treatments are expensive, and they run between $250 to $295 per session. Next treatment is a surgical curettage with pulse dye laser. So this, with these more advanced treatments, if the topical treatments are not working, we kind of move to the more advanced treatments, and the microwave treatment and this curettage and laser are more advanced treatments. So with the curettage and laser, the foot's numbed up. It's usually done in the operating room. Sometimes you can have it done in the doctor's office if he or she has a laser. So the foot's numbed up with local anesthesia, and the wart is scooped out with a curette, a dermal curette, and it's really easy to scoop it out because it's really well defined from the normal skin around it. And then a laser is used, the pulse dye laser, and the light from the laser heats up the blood vessels in the wart, destroying what's left of the wart, because there's all the wart virus is everywhere in that area. There will be a wound, and so there's non-weight bearing for about 2 to 3 weeks to prevent plantar scar formation. I always use Aldera and Epudex for at least a month after I scoop it out and use a laser, because the wart virus just hangs around, and that's meant to prevent any recurrence from the wart setting up shop again. Treatment's highly effective, and I think my entire career I've only had 2 recurrences after I've done that technique. Problem is the laser device is expensive. Most doctors can't afford to have it in the office, so you have to go to a surgical center or in the hospital to have it done. Most community hospitals, unfortunately, don't have a laser that does this. Personally, if I had a stubborn wart, I'd first try the Vircin or the prescription topicals with the 40% salicylic acid for 8 weeks. If at that point it wasn't resolving, I'd try to look into the swift microwave treatment or the curettage and laser. So we'll go through some of the different warts and what they look like when they get treated. So the wart here, when you treat it with a keratolytic, it usually turns white and it stays kind of white, and then gradually, as the callus is shaved over top, the wart kind of gradually comes on out over time, as you can see there. So a wart responding to the chemical treatments like the Epudex, the Aldera, the Vircin, they'll start to get darker, and you know that the wart's starting to die, and they'll eventually like turn into a scab like that and fall off. And scabs are means that it's just about ready to fall off, and they'll start lifting off. You might get a wound there too when it starts to come out, and then you have to treat the wound as it's resolving. And I always have my patients use the Aldera Epudex for at least a month after it looks like it's gone, because it's always hanging around and can set up shop again. Also, I do adjunctive treatment, especially if there's a sweaty foot, because that moist, sweaty environment the virus thrives in. So I have the patient use dry sol and put that on once a week, because the sweat will take the virus on other areas of the foot and it'll set up a new wart someplace else, or cause a mosaic wart, which is really, really hard to resolve. Other treatments include bleomycin, which is a chemotherapy agent. That works really well too, but it's very painful to get. It's an injection. We numb up the wart first and then inject this bleomycin, and it basically turns it, immediately turns it into like a scab or like a hematoma, like bloody fluid, and then it'll fall off. There's other topical chemicals can throw and try chloroacetic acid, which work well, but they're painful to have applied. So bleomycin, cantharin, trichloroacetic acid, or more painful agents. So I don't use those as much because of that. Now, treatments that do not work on the bottom of the foot is freezing the warts off. For some reason, it just doesn't work on the bottom of the foot. I don't like using it because it hurts. It makes a blister, and I don't like my patients to walk on blisters and be painful. So I don't use the freezing off method. And the freezing off treatments that you can get over the counter just plain don't work. Please don't waste your money on those. So that's primarily the treatment that does not work. So over my career, I usually try to offer treatment that are least painful, most effective, and most cost effective as possible. Patients or individuals and treatment plans also have to be flexible and personalized, and there's also a lot of obstacles that the health insurance company throws up. So this is why I kind of curated these different treatments that I discussed with you. And I hope this helps you resolving your warts. It just takes time and patience. You got to stick with it, do these treatments, work with your podiatrist. And if this episode has helped you and you got some value out of it, please like and subscribe. I appreciate it very much. Thank you. Hey, thanks so much for watching today. If you've learned anything or if I've helped you at all, please like and subscribe to my channel. And please leave me comments and I'll answer any questions that you have. If you have any topics you'd like me to cover, please leave that in the comments as well, and I'll do an episode on that in the future. And thanks so much. We'll see you next time. Please see the full disclaimer in the description. This is not a doctor-patient relationship. This is for informational purposes only and is not medical advice.